You're welcome to the Policy Council. My name is Okweyemi Agbaje. In this edition, we talk about health insurance. What is it? Why has it not fully taken root in Nigeria? What can we learn from global experience, especially from the US and other markets? And what about the legislation? What's the future for the sector? I have an expert leader in the sector to discuss these issues with me. Enjoy the program. You're welcome back. It's the Policy Council. I have a fantastic guest this evening. She's the CEO of Avon Healthcare Limited, popularly known as Avon HMO. She is a lawyer. She holds a master's in management from the London Business School, a Sloan Fellow in the Global Leadership and Management Program of London Business School. She's worked in financial services, in banking, in FMCG, in telecoms, and she was acting CEO of another health management company, Hygia, for some time before becoming CEO of Avon HMO. My guest is Adesimbo Ukiri. You're welcome to the Policy Council.
Thank you very much. I'm happy to be here.
Thank you very much. Let's make our viewers understand. Many of our viewers don't understand what health insurance, health management organizations, or HMOs are. What's the concept, and how does it differ from regular insurance?
Okay, first, I mean, in Nigeria we use it interchangeably. We say health insurance companies, and we also say HMOs, health management organizations. Basically, what happens under a health insurance scheme, the kind that we run in Nigeria, is what you can refer to as risk pooling. So what happens is you get a number of people together who pay premiums, and in return for paying premiums, certain health benefits are covered under the insurance scheme. So when they visit a hospital to access these healthcare needs, they don't have to make any payments out of pocket. Now, it's a great way to give access to affordable healthcare to large numbers of people, because very often ill health doesn't give you notice. It might come at a time when you actually can't afford it. And I mean, across the world, it's also been discovered that this is actually the best way to ensure that affordable healthcare services are available to the masses. Because, for instance, the cost of treatment for cancer is incredibly high. The cost of managing, a heart failure incident is very high. And it's way above what many average Nigerians can afford. But with health insurance, you're pulling resources from a wide pool of people, and the risk is diluted. So X might get a heart attack today and need treatment, but Y is healthy. So it's a way in which the more healthy people are helping to pay the costs of healthcare services needed by the ill people. And because we all don't know when we're going to be ill and when we're going to need these services, we all have an incentive to pay the premium. So when it's our turn and we fall ill or we need medical services, we can have access to the financing that will pay for what we need. So in a nutshell, that's what it is. In Nigeria, there are over 70 licensed HMOs across the country, and we have a regulator called the National Health Insurance Scheme.
Let me ask you, you can draw on experience from financial services, telecoms, other sectors. Why hasn't, essentially you would agree with me that health insurance, HMOs, they've not really taken deep roots in the Nigerian psyche. Drawing on your experience across sectors, say contrasting with banking, why do you think this is so?
I think that it's evolving. I know that the history of the past 8 years is not doesn't give one any reason to beat one on the chest and boast about it. But it is evolving now, and part of the problem has been a general distrust of all things insurance. So a lack of awareness, not enough education to the population about how health insurance can be of benefit. Also, part of it is also because as a people, I think we tend to be very positive. I don't know many Nigerians that like to write their wills. I don't know many Nigerians that like to think about the possibility, of some catastrophic health, illness befalling them. But I think now, you know,
go and pray and say, I reject it.
I reject it in Jesus' name. I forbid, you know, God forbid, you know. But now I think that the awareness is there, it's strong. There are social media and the ability, you know, just to disseminate information very quickly also. And people are becoming also much more aware and open about the kind of health problems that they have. In previous times, you know, people who had things like cancer would never talk about it. Their families would never let anybody know that's what they had. You know, but people are coming up now. Everybody's aware about prostate cancer. Everybody knows about hypertension and what it can lead to. Diabetes is very openly discussed amongst friends. And, you know, so people just now are more open and not ascribing their illnesses to the villagers being after them or witchcraft and things like that. So there is a wave, if I want to call it that, of awareness now about, you know, the need to have some kind of, you know, financial access to health services, being there, you know, no matter how well off one is. Like I said, when some of these costs hit you, not many people can afford to just dip hands in the pocket and pay. And the whole concept of universal health coverage is to make healthcare services available and affordable for people so that they don't then have catastrophic, you know, financial implications. People don't end up selling their houses, selling their, you know, their cars just to be able to pay for healthcare services if something happens to them.
Excellent, good start. Let's take a short time out. I'm talking to Adesimbo Ukiri. She's CEO of Avon HMO, and we're talking health insurance in Nigeria. We'll be right back.
Who knows Abi better thing? Abi who know like better thing? All these fine things where they see so. Now money government they take do and now. Abi, I think it's like, you know, I mean, excuse me, I dey pay my tax. I dey do it, I dey pay my tax. Say you don't pay your own tax. If you pay your tax, I pay oh.
Pay your tax. It's your civic responsibility. It's your duty. It's the law.
You're welcome back to the Policy Council. We're still talking health insurance. My guest is Adesimbo Ukiri. She's a Sloan Fellow of the London Business School. She holds a Master's in Global Business Strategy and Leadership from that school. And she's the CEO of Avon HMO. So, Simbo, let's talk. You mentioned the NHIS, which is the regulator and maybe also has a scheme, I think. Yes. Tell us about those for the benefit of our viewers.
The NHIS is the National Health Insurance Scheme, which is both a regulator and an operator. So the NHIS regulates the activities and operations of all the licensed HMOs in the country. The NHIS actually also is responsible for licensing organizations to go into such as ours, to go into that line of business. But in addition to that, the NHIS also comes up with health insurance plans. You know, so right now there's a formal sector scheme which the NHIS has come up with, which is a plan that is made available to federal civil servants across the country. The NHIS has also come up with some plans for university students. There's also plans, you know, for disadvantaged or what we would call vulnerable people in the society. So the NHIS, you know, is on one hand an operator who comes up with different health plans and prices them, you know, and but even though they come up with these plans and price them and develop the plans, you know, they also work with HMOs to implement the plans. You know, but on the other side as well, HMOs do come up with their own private plans as well, which they offer to the public.
Let me ask you, do you think this, because I know about the experience across other sectors where we have institutions that in effect are both regulators and operators. It's usually not an ideal scenario. What's the case in health insurance?
I think that is an area that is being looked at now. Like I said, the health insurance, you know, industry continues to evolve. I mean, we've had a series of leadership. I mean, the new executive secretary of the NHIS is Dr. Olufemi Thomas. I know that a while ago there was a body of work commissioned, you know, by the IFC, and Accenture was involved. I think that was actually the lead consultant that was in charge of the project, looking at the entire national health insurance scheme, the NHIS, the operators, etc., with a view to making recommendations on how to accelerate the growth of that sector and how to ensure that we start beginning to, you know, be able to boast as a country, that we are on the road to achieving universal health coverage. So I believe the role of the NHIS and, how it is repositioned to take, the universal health coverage mandate to the next level is something that the leadership of NHIS is looking at very, very closely now. Yes.
Okay. So let's go into more substantive discussions around the NHIS schemes, and we'll talk about the private schemes later. But how do you think those schemes have done, and what role does organizations like yours? You said that they do it in partnership with you. What role do you play?
Okay, so I have to try and refrain from talking about too much statistics here.
Yes.
But I think generally the clear indication is that as a country we still have a lot of mileage to cover when it comes to health insurance for the totality of the population. If you ask most people in the industry now, they would say penetration is about, it's not something we like to discuss, but we think it's in the range of about 5%.
Wow.
But very happily, as a country, we have given ourselves a mandate to move to 30% coverage by 2015. I mean, this is something that I know the Executive Secretary of the NHIS is extremely passionate about. So is our President, His Excellency Jonathan Goodluck. There is a health summit which he has convened, which will occur in March, that is bringing all the stakeholders in the healthcare sector together. And really, that summit is all about developing a road plan to help Nigeria as a country achieve universal health coverage and get up to 30% of the population by the year 2015.
Oh, that would be good.
Yeah, that would be really good.
Okay, so how about so in the NHS schemes, you are the ones who sell them to or manage them on behalf of?
So the role of the HMO within the NHIS scheme is that it's the HMO that actually does the registration and the enrollment. So they are the ones who go to the institutions that whose staff are meant to come onto the scheme and educate them about the scheme and how it works. So they are the ones that go and get these people enrolled and collect all the data that needs to be collected. They also interface with the hospitals through whom these services are provided. So they are the ones that carry out checks on the hospitals. They are the ones that make referrals from one hospital to another hospital if the first hospital doesn't have the required standard of expertise to treat the ailment. So you can say in a way that the HMOs act as the middleman who ensures everything works well. So that's the role that the HMO plays when it comes to the NHIS schemes.
Okay, we'll talk later about the private schemes that institutions like yours have, and then I'll talk about these words that I've heard so often in the healthcare debate: pre-existing conditions. We'll be right back. You're welcome back. We're still discussing health insurance. My guest is Adesimbo Oyukiri. So, Simbo, let me ask you, there's this whole debate, and it's not just a Nigerian thing. We've heard about this whole debate about pre-existing conditions in the Obamacare debate in the US. What's pre-existing conditions, and how does it matter to health insurance?
Okay, I can make it really, really simple. So health insurance, like all other insurances, is meant to cover you in case of an unforeseen and unexpected occurrence. Now, it makes it extremely risky when mass retail products, health insurance products are sold and there are no pre-existing insurance clauses. Now, what pre-existing clauses normally say is, and they differ from country to country, but there are specific conditions which, when you take out a retail health insurance product, you have to declare, and when you declare it, it will not be covered for an initial period of 1 year, some countries up to 2 years. Some countries even have you, if you have had those conditions for 1 year previous, then you can't go on a health insurance scheme. Now, the main reason why that is done is because it's health insurance. If we went out into the market now and said, okay, these are the retail health insurance products we have, the first people who will buy those health insurance plans will be people who are really ill. It's called adverse selection. So
you would end up with a portfolio of people with cancer, hypertension,
diabetes, people who know they've been scheduled for surgery but haven't been able to afford the surgery. So that
and
is
they'll
why
pay a small premium.
they pay a small premium, you know, and then maybe pay a premium of 20,000, 25,000, and then be able to access a surgery that costs 200,000. Because that's what health insurance is supposed to do. It's supposed to be able to finance your ability to access such expensive care, you know. So pre-existing conditions and, you know, the clauses around them are put into these policies so that at least for the first 1 year, the health insurance companies have the opportunity to build up a pool
of healthy people.
Yes, of healthy people, and also to build up a pool of funds from which they can then have recourse to for subsequent, you know, occasions that require.
So put simply, you are supposed to go into health insurance as a healthy person.
Not quite. It is advisable that you go into health insurance when you're still healthy, because then it becomes more difficult to go into health insurance when you're already ill. It's not impossible, but the pricing is different because, I mean, then if we do a simple arithmetic, what it will mean is that your pre-existing conditions are certain, you know, there are events that will occur as of certainty.
So it's no longer insurance.
It's not insurance. If it's going to occur, certainly, then what some insurance companies would also do is that would be priced into the price that you are given.
The premium becomes very high.
The premium becomes very high. So if you're hypertensive and you want to be able to, you know, from day one, access all the health services that relate to hypertension, your plan will be priced differently from someone who is coming in and has no chronic ailments whatsoever.
So what, in effect, the flip side of this, like the Democrats and Obama have argued, so the person with pre-existing health conditions essentially gets doomed, isn't it? That's
no, not at all. The person with pre-existing health conditions will still get taken care of.
Okay.
At a higher cost.
At a higher cost.
And depending on what the person's preference is, the person could choose to observe the moratorium.
Okay.
And it differs, like I said, from country to country, from health insurer to health insurer. But the moratoriums will range from within a year to about 2 years.
Okay.
So a person with a pre-existing chronic health condition could say, you know what, you know, I'll serve out the moratorium and take care of myself for these 2 years because it's in my best interest to enter a scheme now before any other further complications arise that I won't be able to afford on my own. So the person enters onto the scheme and serves out the moratorium period and then is able to access a comprehensive range of benefits that are tied to his condition. Okay. Or the person could say, you know what, I'm going to shop around for a health insurance policy that will cover me from day one, even though it's going to be a lot more expensive. But whichever way, the best option is always to take out a health insurance policy.
The moral, my dear viewers, get health insurance before you really need it. Let's take a time out. We'll be right back.
Government wants our city to become a mega modern city. And so, government is providing modern markets for us to carry out our business. Now, this requires money. So, we need to pay our taxes to help government to help us. I pay my taxes. I hope you've paid yours. I pay. Pay your tax. It's your civic responsibility. It's your duty. It's the law.
You're welcome back. It's my last segment with Adesimbo Ukiri. She's the CEO of Avon HMO. She's a lawyer. She's a Sloan Fellow of the London Business School, holds an MSc in management from that institution, and she's worked across sectors, finance, FMCG, and now healthcare management. So, Simbo, let me ask you about legislation in healthcare management, HMO, health insurance in Nigeria. Are you satisfied with the state of legislation in this sector?
There are two crucial bills which the whole healthcare sector has been waiting for with bated breath.
Okay.
One was recently passed by the Senate,
yeah.
And which is the National Health Bill. And it does have provision for some deductions from the Federation account towards a national health insurance scheme. The other piece of legislation which is crucial is the National Health Insurance Act itself. And a key amendment to that act which we are waiting on is an amendment that makes it compulsory for all employers of labor in Nigeria with, you know, up to a certain number of staff to ensure that their staff and their families are on a health insurance scheme, be it the National Health Insurance Scheme or a private health insurance scheme. The important thing is, you know, we need people to be
some
covered.
level of compulsion.
Some level of
compulsion.
compulsion.
The Nigerian Obamacare.
Something similar
Something
to
of that nature. Except that we'll have to make sure we get our technology right.
Technology
in
is
Nigeria
crucial.
case.
Yes.
Okay. Now let's talk about. So you spoke about private schemes. Let's talk about Avon HMO. When you started a year ago, what's your experience been in the market? What are you doing to the people? What kind of services are you offering? How are you different?
Okay, so we started operations at Avon HMO last year, January, and it's been extremely interesting. So even though we are a new company, I mean, the management team and a lot of our staff are not new to this healthcare sector at all. You mentioned in your intro that I used to act as managing director of Hygia HMO, and within our executive team, we have experience that spans over the past, 8 years of the HMO industry within the country. And coming into this market, we were determined to make a significant difference. The first is that, we do have this vision of ensuring that everybody that we engage with is healthier and is able to have a fuller life as a result of the engagement with us. So we don't just sell health insurance plans. We work with people to make them healthier and to give them a better quality of life. And that's a very key distinguishing factor between us and a lot of our contemporaries. And how do we make that happen? We decided very early on, because hospitals are so crucial to the value that we offer, that our different, our relationship with the hospitals, we call them providers, that we use are going to be managed differently and structured differently. So in the past, it's not a secret that the relationships between HMOs and the hospitals through whom the services are provided haven't been extremely cordial. And we are changing all of that. We refer to them as our partners. So we actually work with them in a way that ensures that, their own business goals and objectives are being met. They continue to be viable businesses, viable commercial entities, because that has been their pain and that has been their complaints from previous years, that they're not paid commercial tariffs and even, those claims that they make based on the low tariffs are not even paid on time. So that's a crucial thing that as Avon we've addressed with the hospitals in the way we relate with them. But also we work together closely with them, helping to step up the level of clinical quality as well as, even the customer service that is being delivered to our enrolled members when they visit this hospital. And tied to the fact I made, the point I made earlier about us being particular about improving the health and the quality of life that our members have, is that we have a unique proposition when it comes to people with chronic ailments. Now, we actually tie each member with a chronic ailment to a specific consultant who they remain with throughout the course of their engagement with us. So in addition to having what we call a GP, a general practitioner, each person that has a condition or an ailment has a specialist that is looking after him or her. And the level of skill of the specialist and the cost of the specialist has no relation to the premium that has been paid by this member, because we give the highest level risk to the most skilled and most experienced, even if the person bought the cheapest plan. So as a whole, we've got a model and approach that is entirely different to what exists. And we believe that at the end of the day, everybody who does engage with us will be healthier for it.
There are two quick questions I want to draw into my limited time left. One, the tendency for Nigerians to seek healthcare abroad, which means if institutions like yours offer foreign, what are we doing about local healthcare itself, the quality of the hospitals and the healthcare services in our sector? The other question is about technical skills, actuarial skills and data in your industry for you to do the work you're doing.
Yes, so the first one, I mean, it's something that's of great concern, because when you talk about access to health, there's financial access, and there's also access on the delivery side, which is what you've just mentioned. The ability of Nigerians to be able to access world-class standard healthcare within the country. I mean, there's also a ministerial committee that's been tasked with ensuring that in each of the 6 geopolitical zones, we have internationally accredited tertiary institutions with diagnostic facilities. Now, this is a journey, but I think now also we see a lot of foreign investors looking at the healthcare space in Nigeria. Prior till now, it's been extremely fragmented. Most hospitals are owner-managed, one-man businesses. We need to see a situation in Nigeria where there are institutional investors investing in hospital chains. We need to see a situation where there are institutional investors owning and managing diagnostic chains across the country. And I think we've started to move towards that. And once we begin to record levels of successes in these areas, then we'll see that, tendency for Nigerians to fly abroad reducing over time.
Okay, data and technical skills in the
yes,
sector.
that is an area in which we are really struggling as a country. I mean, for this industry to really take off, we do need to have strong capabilities in actuarial and underwriting, competencies. And across the country now, we have extremely few actuarials, qualified actuaries. And the few of them that do qualify, whilst working with Nigerian firms, as soon as they get the qualification, they're off to South Africa or Europe, where their services are better rewarded. So there's a two-pronged approach to it. The first is to look at ourselves as an industry and decide that we will pay commensurate remuneration as these actuaries are able to command when they go outside the shores of the country. The second is that actuaries need data. We're not a country that is, that is known for generating good quality, robust data over lengthy periods of time. If the data don't exist, they don't have what to work with. So that's the next thing that we need to focus on, and we are actually starting off as Avon HMO, ensuring that we have quite robust data. So in like 5-10 years from now, I dare to say we will have enough data for an actuarist to get excited about getting his teeth into.
Fantastic, good stuff. Adesimba Okoye, thank you for coming to the Policy Council. We'll be right back. That was a very good discussion. I have 3 important takeaways from my conversation with Adesimba Okoye. 1, we need health insurance to ensure sustainable financing for healthcare for all our people. 2, we need to improve the quality of health services, hospitals and healthcare systems available domestically, and we're on the way to doing that. Finally, for you, the viewer, get health insurance before you need it. When you really need it, at the time you're getting it, it's going to be much more expensive for you. My guest says her company offers health insurance services for individuals, for families, for companies, for government and communities. Talk to a health insurer today. Thank you very much for watching. See you next time.